Good afternoon, everyone. Welcome to today's virtual education. We're going to give everyone a few more minutes to join and then we'll begin. All right, let's go ahead and get started. Welcome to today's virtual education. My name is Carrie Rutia. I'm an Oncology Outreach Coordinator here with the Samaritan Cancer Resource Center. We're so excited for today's presentation on the topic of cancer and heart disease. Before we get started, let's go over a few virtual housekeeping items. For today's presentation, it's being recorded. The recording will be available online at a later date. We are using the universal mute button, so please use the chat box in the top right corner to ask any questions. Erin Dunn will be monitoring the chat box throughout the presentation, and as time allows, we will go over questions at the conclusion of the presentation. All right, I am pleased to introduce our guest speaker for today. Athena Nofziger is a registered dietitian and is board certified in oncology nutrition. Athena graduated from Oregon State University with a Bachelor's of Science in Nutrition, and she completed her dietetic internship at the University of South Dakota. Athena has worked for Samaritan Health Services for 15 years and with the Samaritan Cancer Program for the last 3, with her focus on anti-inflammatory nutrition and culinary nutrition. She helps her clients meet their wellness goals. In addition to being passionate about food and nutrition, Athena works on her family farm with her husband. They grow a variety of vegetable seeds for production. Athena enjoys being a part of the food production process from farm to table. All right, so without further ado, welcome Athena.
Thank you, Kara, very much for that very nice introduction. And I'm really excited to be here today to be talking about this topic. So I'm just going to briefly go over what I'm going to talk about for the next few minutes. So I'm going to be addressing the risk factors for heart disease and cancer, and kind of the thought process behind this is we often think of these things as like two completely separate diseases. We have different doctors we go to for these different conditions, but just thinking about them in the aspect of how are they connected. And then since I will be addressing diabetes during this, that does bring up the topic of sugar and cancer. So I'm going to talk about sugar and cancer as well as sugar intake and heart disease. And then finishing with some nutrition information. So I'll talk about nutrition and cancer and nutrition and heart disease and how those things are connected as well. I did want to just note that the heart disease that I'm talking about during this presentation is around like lifestyle heart disease, genetic heart disease, and I won't really be going into sometimes we have increased heart issues from cancer treatment. So that isn't really what I'm going to address. I have one slide on that, but for the most part, that isn't one of the objectives I'm talking about today. Okay, so I wanted to start with a few numbers first. So 16.9 million people in the US have a history of cancer. And 2/3 of those are 65 and older. And the reason I'm mentioning these numbers is because most of us as we get older are at an increased risk for heart disease as well as we get closer to 55. So we're kind of at an increased risk for both conditions. And then people with a more than 5-year survival rate have a 1.3 to 3.6-fold greater risk of cardiovascular disease if they have more than 5-year survival rate of cancer. So just kind of just some numbers to show that these two conditions may be connected to each other. Okay, so now I'm going to start going through the different risk factors for heart disease and for cancer, and in the ways that we're at risk for both of those. So first, starting with tobacco, most of us are pretty familiar with the fact that using tobacco products increases risk of cancer through carcinogens. We're consuming carcinogens, and then increases inflammation and then damage to our DNA. And real quickly, I just want to give you a definition of inflammation. So throughout this presentation, I say inflammation. And so when I am talking about that, I really mean chronic inflammation. But I do want to give you a quick rundown of chronic versus acute inflammation so it makes sense as to what I'm referring to. So when we have acute inflammation, I think of when maybe I cut my hand or I hurt myself and that area gets red and swollen and inflamed, and then my body repairs that damage, and then the inflammation goes away. In chronic inflammation, that really just means that we have some type of damage to our body going on, and our body is inflamed, but it doesn't go away. So I'm going to use the example of high blood pressure. So let's say I have high blood pressure because I follow a high salt diet. And so my blood pressure is high, which puts more pressure on my artery walls. And over time, that causes damage to my artery walls. So my body has to fix that. And so that damage is a type of inflammation. And so I keep eating salt, my blood pressure stays high, and I keep damaging my artery walls. So my body is in that constant state of having to repair itself. So that's what I mean when I say chronic inflammation. Your body is in that constant state of repair. Okay, so then thinking about tobacco and heart disease. So we do know that tobacco increases our risk of heart disease, and this often happens because using tobacco products damages our arteries. And then when our arteries are damaged, our body fixes that by depositing plaque there to repair the damage. And so that leads to atherosclerosis, so too much plaque in the arteries, and then the artery becomes blocked off or clogged. Okay, so then I'm going to move on to hyperlipidemia. So hyperlipidemia is high cholesterol, and we know that high cholesterol levels, especially that LDL level, which is like what we hear when we hear, that's the bad cholesterol, LDL. And so that increases atherosclerosis, so that plaque buildup. And then in regards to cancer, when I was looking at the different articles that I referenced for this article, or this presentation, there wasn't really conclusive evidence that having high cholesterol specifically increased cancer risk, but that really it would just be more of like the inflammation issue. So, having higher cholesterol and total cholesterol is more of an inflammatory condition, so that may increase cancer risk. But I couldn't find that exactly the high cholesterol increased your risk of cancer. Okay, so now I'm going to move on to hypertension. So first I'm going to talk about hypertension and heart disease, and then I'll talk about hypertension and cancer. So the definition of hypertension is high blood pressure. And I kind of talked about this already, but this is when you have more pressure on your blood vessels and it's constantly too high. So just that pressure on the outside on your blood vessels is high. Okay, so then over time, like I said, that high blood pressure damages your arteries, and we have that buildup of plaque. And then the arteries can become blocked and prevent blood flow to your heart muscle. If we have hypertension, we are also at increased risk of stroke, and this is because blood vessels in the brain can become more clogged more easily. And then also over time, if we have hypertension or high blood pressure, this can lead to heart failure. So that just means that the heart is having to work harder, basically because there's more pressure, in the arteries and vessels, there's more pressure. So the heart has to work harder to push the blood through. And then after time, it can become enlarged. So then when the heart gets too large, it doesn't efficiently pump blood like it did before. So that's our concern of hypertension and heart disease. So now I'm going to move on to hypertension and cancer risk. So there are some associations that having hypertension increases risk of different types of cancer. People with hypertension have higher levels of VEGF, and this is vascular endothelial growth factor. And this is not something that you have to remember. I'm just sharing this information. So what's concerning about this VEGF is that it promotes blood vessel growth. And when we really get concerned about it is if it's promoting blood vessel growth to tumors. So they have found that people who have hypertension have higher levels of this growth factor. So that is concerning for hypertension and cancer risk. Also of note is that when people are going through treatment, many cancer treatments aim to block this growth factor, this VEGF. So meaning that their treatment blocks this growth or blood vessel growth to tumors. So it's really important during different treatments that you manage your hypertension so that this level of VEGF does not increase, and so that the cancer treatment can work as good as we want it to. Okay, now I'm going to move on to diabetes and heart disease. All right, and I'm going to talk a little bit here about insulin resistance, but I have several slides about insulin resistance, and I'm going to get into that in a little more in depth. But if we have insulin resistance, this can lead to elevated LDLs and triglycerides. And remember that the LDL is what when you hear that word, that's your bad cholesterol. So if we have more insulin resistance, we tend to have elevated LDLs and triglycerides. Having elevated blood sugars can damage your blood vessels again, leading to plaque buildup. And so then if too much plaque builds up, that cuts off the blood flow to the heart. Also, when our blood sugars are high, IGF-1 can promote vessel wall inflammation. And I'm going to talk more about this IGF-1 acronym in a minute. But when we have higher levels of this IGF-1 and our vessel walls are inflamed, this eventually leads to more plaque buildup, which then, like I said before, will eventually clog the arteries. Okay, so then moving on to the diabetes and cancer risk. So if we have high blood sugars, then we make more insulin, and I'm going to talk about this a little more, but hyperinsulinemia and IGF-1, this insulin-like growth factor, promote uncontrolled cell growth and inhibit natural cell death. And I know that sounds kind of funny because it doesn't sound like we would want we want our cells to die. But if maybe you remember during science class in school, you learned about the cell cycle, and your cell is made and it goes through the cell cycle, and then your cell dies, and then your body makes new healthy cells. And so when we have higher levels of insulin and IGF-1, this stops this natural healthy cell death. So that isn't something that we want. Also, elevated insulin decreases our liver production of binding globulin, which increases estrogen in the body. And so this is more concerning in regards to hormone-related cancers if we have higher levels of estrogen in the body. So having more insulin decreases the production of this globulin. Also, if we go back to my definition of inflammation, diabetes is a chronic inflammatory condition. So it's one of those conditions where your body is in a state of constantly repairing itself, which increases inflammation. And the more inflammation we have in our bodies, it just kind of makes a happier environment for cancer to grow. Okay, so I am going to now get into more of the cancer and sugar concern and insulin resistance, because I think that kind of goes, that's usually the question I get after I talk about, diabetes risk and cancer disease is, how does, does the sugar feed the cancer, and do I need to cut, carbohydrates completely out of my diet? And so I want to talk about how our body processes and uses the food that we eat. So this is just a basic diagram of digestion and how we use our carbohydrate foods for fuel. So you can see here that we're eating a strawberry here, and then it gets into that big blue circle and it's digested. And any carbohydrates that we eat, they are broken down into sugar, into glucose, and that's the main source of fuel that our body uses. So it's broken down into glucose, and then the next step is that we want it to get inside of our cell. So we have this smaller blue circle here, and it looks like it has a little knob on it. So this smaller blue circle is the cell, and this little knob on it is what we're referring to as an insulin receptor. So that's where the glucose has to go through in order to get into our cell. In order for that to happen, we need insulin. So our pancreas has to make the insulin, and the insulin here we always refer to it as a key. So it's the little keys floating across the screen here. So the insulin has to go out to the cell, unlock the cell basically in order to let the glucose in. And so then once that happens, then our body uses the glucose for energy, for fuel. And we need that fuel. I'm talking about fuel for, for our brain to work, for digestion, for fuel to, get through your workday, that kind of fuel. And then, we also need energy if we're doing something physically active, but we do need that just baseline energy in order for our bodies to function. Okay, and then on this slide, just some additional information here. So you see those words excess glucose. So if we eat something and we don't need all the energy that it's providing, we have excess glucose, then it goes to our liver and gets stored as glycogen. And this is kind of another quick energy source that our body has. So let's say between meals, I go work out and I've burned through all the fuel that was in my cells. So I need more in order to keep my workout going. And so that's when we use this glycogen. If I have excess glucose beyond that, then my liver starts getting it ready to store for fat and stores it as triglycerides. Okay, so now I'm going to talk about cancer cells and sugar. So this little blue circle here is the cancer cell, and all the little kind of red knobs on it are the insulin receptors. And how this is different from a healthy cell is that cancer cells have more insulin receptors on them. So cancer cells have more opportunity to uptake more glucose. And so that's where this sugar feeding cancer concern comes from, is the fact that the cancer cells use more of this glucose than healthy cells. So even though that is concerning, when I talk with people about, the sugar feeding cancer issue, it's really more about the insulin. And this is because insulin, and this is where that acronym came from. So insulin, like growth factor. Insulin makes things grow. So the more insulin we have in our body, that makes things grow. And that's what we're concerned about, that this growth factor is making cancer cells grow. So now I'm going to move this same topic on to insulin resistance. And not, insulin resistance is often this kind of, let's see, insulin concern. If our bodies are, if you eat something and your body makes insulin in order to to use the food for fuel, that is normal and that should happen. So I don't want to come off like, anytime you eat carbohydrates, then you make insulin and this is making things grow. This is a normal process of how our body works in order to get us fuel for energy. So this is all fine. It's when we are in this insulin resistance issue is when it's a concern. So just another review of this. So after we digest the food, the blood sugar enters our bloodstream. And down here on the left, the diagram here on the left, we have the green sugar, which is going to use this blue box in order to get into the cell. So the blue box here is the insulin, and it's unlocking the light blue box, which is the insulin receptor, gets into the cell and makes energy for us to use. So when the blood sugar enters the bloodstream, the pancreas makes the insulin to get the blood sugar into our cells. So this is all fine. When it's a problem, as you can see on the right side, this diagram, that light blue box isn't the same shape as our little insulin blue boxes anymore. So the insulin cannot unlock the cell for the sugar to get in. So now I have more sugar in my bloodstream. And I also have more insulin. And since I still have sugar there, my pancreas keeps making more insulin, trying to get the sugar where it's supposed to be inside of the cell. So this is where it's concerning in regards to insulin resistance. So I have elevated blood sugars, which increases inflammation. And then I also have this excess insulin now, which tends to make things grow. Okay, and then just want to reemphasize with this relationship is that the concern here is if I eat a large volume of sugar and then my blood sugars are high and I have to make more insulin. So there's a big difference when I talk to people in, do I need to do like a carb-free diet, or are we talking about, eating fruits and whole grains versus simple sugars, a lot of candy, soda, cookies. There's a big difference there. And so the concern is like quick carbs or simple carbohydrates at large volumes, that makes our blood sugars go up. And then we have to make more insulin than we normally would in order to deal with that sugar. So like I said, the insulin stimulates the growth. It increases those inflammatory hormones. And then the other thing that happens is high blood sugars suppress our immune function. So then just, suppressing our immune function decreases our ability to fight off cancer. Okay, so now I'm going to move on to obesity. And with this, I'm going to talk again about the insulin resistance piece in just a moment. But I want to start with obesity and heart disease risk. So quite often when people who are obese also are at risk for diabetes, higher blood pressure, higher cholesterol, insulin resistance, and an increase in inflammation. So all of those things increase your risk of heart disease. If we're talking about cancer, obesity increases inflammation. And then also, I'm going to show you another chart here in a minute, but obesity increases risk of several different types of cancer. So this might be a little small. So I'm not sure how well you can see it, but I'll briefly explain it. So the column I want you guys to look at is over here on the right. And you can see all of these red and orange squares. And these are all in a column that's called adult body fatness. Sorry, I'm having trouble reading it myself. And so these are all, they're all related to different types of cancer. And so the red and orange boxes, if we look at this key down at the bottom, the red is convincing increased risk and probable increased risk, or sorry, the orange is probable increased risk. And so all this is saying is that having more body fat increases risk of several different types of cancer. And this chart comes from the American Institute for Cancer Research. They have this project called the Continuous Update Project, where they're constantly looking at new research articles that are put out and putting together this information for us in regards to what increases cancer risk and what decreases cancer risk. So this is where this information is coming from. And at the end, I have a website for you if you're interested in looking up more about this Continuous Update Project. Okay, so insulin resistance one more time. So this time I want to talk about insulin resistance in relation to obesity, which increases our risk of heart disease. So if we eat excess sugar, which is excess calories, this leads to obesity. If we have more adipose tissue or we are obese, this causes insulin resistance at the muscle cell. So it's those same pictures that I showed you before. So obesity causes that insulin resistance so that the insulin is not able to unlock the cell and the sugar is not able to get into the cell for fuel. So when this happens and we have this excess sugar out there, our body's going to eventually store it as triglycerides. And elevated triglycerides increase risk of heart disease and eventually turn into that LDL cholesterol. And then the circulating insulin tells the body to store more fat. So it's kind of a vicious cycle going on. The insulin says to store more fat. So, okay, so moving on to hormones and weight management. So really the overall message here with hormones and weight management is going to be weight management. And the reason I say this is because I get asked a lot about, are there certain foods I should be eating in order to improve, hormones in my body? So like I said before, adipose tissue or the fat tissue that we have in our body causes insulin resistance, and this increases inflammation. Leptin is a hormone, and this is produced by adipose tissue. And so if we have more adipose tissue, then we produce more leptin. Leptin increases that uncontrolled cell growth. So we don't want things growing uncontrollably because this is concerning for tumor growth. Leptin also inhibits apoptosis. So apoptosis is a fancy word for that healthy cell death that I was talking about before. So having more leptin stops that healthy cell death. And then leptin also promotes angiogenesis, which is another fancy word, but all it means is that the blood vessel growth to tumors. So if we have more leptin, then we have more blood vessel growth to tumors. All right, there's another hormone that we have that is called adiponectin, and this hormone decreases insulin resistance and decreases inflammation, and it also promotes that healthy cell death. This hormone is a good hormone, but it's actually reduced when we have more adipose tissue or when we have more obesity. So again, just kind of making the point for that, it's more about the weight management piece versus the food, particular foods. Also, adipose tissue is a primary site of estrogen production. So this, I get asked a lot of, what foods do I need to eat in order to decrease estrogen in my body? So really it comes back to weight management. If we can reduce some of that adipose tissue, then we're going to be making less estrogen. Okay, so kind of saying the same thing again. So if we're really focusing on weight management, that reduces the adipose tissue, improves our blood sugars, we have less of an insulin response, reduces overall inflammation, we have improved immune function, improvement in our cholesterol, and improvement in blood pressure. And so it goes back to eating a healthy, balanced diet to promote that weight management instead of focusing on, a lot of the specific diets that are promoted out there or superfoods or food types. It comes back to the big picture of a healthy lifestyle. I think superfoods can be added in addition, but just adding them in as part of the big picture. All And then I am going to get more into the nutrition piece, but first I want to kind of finish up looking at these risk factors with talking about alcohol for a moment. So I'm going to start with alcohol and heart disease. So, in the past, when we talked about, a heart healthy diet, we always said, one drink a day for men, 2 drinks a day for women, or sorry, backwards, 2 drinks a day for men, 1 drink a day for women, and, recommending that people consume red wine because it has the grapes in it and antioxidants. And really, these are not like really big controlled studies. So I never felt comfortable saying like, yes, you need to include red wine as a way to prevent heart disease. Excess alcohol intake increases triglycerides, increases blood pressure, your increased risk for cardiomyopathy and just cardiovascular events in general. So that's with excess alcohol intake. In regards to cancer risk, so alcohol intake increases risk of most types of cancer. There's oxidative stress. There's like basically just like the toxic effect of the acetaldehyde. So thinking about like the alcohol just like damaging the tissues directly. There's an increase in estrogen with regular alcohol consumption. And then alcohol interferes with our absorption of folate, and folate is really needed to make healthy DNA. And we want healthy DNA for cancer prevention. So really the recommendations are kind of different. I'm being reasonable about alcohol. Like if somebody asks me if they can have, wine at Christmas or something, that's totally fine. But the heart disease recommendation that we used to say it's okay, for 1 drink a day for women, 2 drinks a day for men, that isn't the same in regards to cancer risk. So we encourage this overall healthy diet, but moderate consumption. But light drinking does increase risk of breast cancer, esophageal, oropharyngeal cancers. And then in regards to cancer survivorship, it is really recommended for several cancer types to just completely abstain from alcohol if you're a cancer survivor. I'm going to show you this chart once more. And so again, we're looking at this column here on the right, the very right column where we've got all the red and orange and yellow boxes. And really, so the red boxes, again, if we look at that key, are that it's a convincing increased risk, the orange is probable increased risk, and the light yellow boxes are that the evidence is limited, but there's a suggestive increased risk of cancer. And so this column is alcohol intake. And so really I'm just wanting to show that alcohol intake does increase risk of several types of cancer. And again, this information is from that continuous update project from the American Institute for Cancer Research. Okay, and so then this is where I said I was briefly going to talk about cardiac risk during treatment. So some cancer treatments can cause more stress to the heart in the form of heart failure or ischemia. And this is all going to be, managed by your oncologists and cardiologists. The other thing, if we're thinking about, more of that, like what I was talking about, the adipose tissue and our hormone response. So quite often during treatment, we don't eat as well. And so we tend to lose, people lose weight, but we lose it in muscle mass, unfortunately. And so when we lose muscle mass, we tend to have more adipose tissue or more fat tissue, which then changes our hormone response if we have more of those fat tissues. And also, change in diet can increase our cardiac risks. A lot of times our taste changes, what the foods we prefer change. So, some people they prefer sweet foods or, eat more sugary foods than they normally would have before. Sometimes it's harder to control blood sugars just based on the food preferences or the treatments. If you're, getting steroids or a lot of the other medications can raise your blood sugars as well. So it can just be a time where things are not as well controlled, and so you are at more of a cardiac risk for that reason. Okay, so if we're moving on to like what we can do about all this stuff. I'm going to start here with a little bit of information about exercise, but this is just kind of moving on to cardiac and cancer wellness. I've given a lot of information, but I want to make sure that I talk about like what are some things you can do in regards to wellness to reduce your risk of both conditions. So I'm going to start with exercise because I'm going to talk a lot more about nutrition. But I want to talk about exercise because a lot of times we forget about this piece in regards to, especially in the cancer world. And it's when people are going through treatment, it is so important to maintain physical activity as much as possible. So big thing with both conditions is we want to maintain muscle mass, and especially maintain muscle mass during and after treatment. Exercise is important for maintaining your weight. Exercise improves your cholesterol. There's an improvement in blood sugars. Exercise reduces inflammation. Often if you're maintaining physical activity during treatment, it can reduce side effects. There's an improvement in lymphedema. So this is swelling related to removal of lymph nodes. So some people who've gone through cancer treatment also have this issue that they're dealing with. Exercise decreases that leptin and increases the adiponectin. So the adiponectin was the hormone that reduced inflammation and reduced insulin resistance. So we have more of that if we are exercising. If we're exercising and maintaining muscle mass, we have a reduction in estrogen. Also, just for dealing with the emotional stress of heart disease or cancer, exercise can help with fatigue, anxiety, depression, improvement in sleep, and just overall improved quality of life. Okay, now I'm going to move on to nutrition. So I'm going to talk about a couple different diets here. So really, talking about like a cardiac diet and then talking about a diet for cancer prevention, kind of in the same way I talked about the risk factors. So with a cardiac diet, the focus here is eating a variety of fresh, frozen, and canned vegetables and fruits, being mindful of the high-calorie sauces or added sugars, and replacing high-calorie foods with fruits and vegetables, choosing fiber-rich whole grains for most of your grain servings, choosing more poultry and fish. We've heard this for a long time in regards to a cardiac diet, and then preparing them without the skin, and then being mindful of adding saturated and trans fats to those foods. And then if you do eat red meat, looking for lean cuts. Eat a variety of fish at least twice a week. And that's where it comes back to eating more foods with omega-3s. So eating salmon, trout, and herring, low-fat dairy products. Avoid foods containing partially hydrogenated vegetable oils to reduce trans fat in your diet, limiting saturated and trans fats and replacing them with your monosaturated and polyunsaturated, cutting back on your sugar sweetened beverages, and then foods that also have a lot of added sugars to them, and choosing foods with less sodium. So the diet recommendation for lowering blood pressure is to eat no more than 2,300 milligrams of sodium per day, maybe even going down to 1,500 to lower blood pressure. And then for the cardiac diet, drinking alcohol in moderation. So like I said before, 1 drink a day for women, 2 drinks a day for men. So that's kind of the rundown of the cardiac diet. There's another diet called the TLC diet, or the Therapeutic Lifestyle Change diet. And this one's a little bit more intense because there's a lot more numbers involved. And so this was more if I meet with somebody, I calculate how many calories they need in a day and then tell them, okay, you need 7% of your calories to come from saturated fats. So I give them a number of, this is how many grams of saturated fat you should aim for in a day. You also need to eat less than 200 milligrams a day of cholesterol, and then 25 to 35% of your daily calories from total fat. So that, again, that's a number I would calculate for somebody taking in their total calories and then, okay, here's how many grams of total fat per day you need to aim for. So this is a little bit more intense, but it definitely is beneficial for somebody who's really wanting to improve their heart health and cholesterol. Also, try getting in 2 grams per day of plant sterols, and this can help to lower your LDL cholesterol. This is really found in plants. And then 10 to 25 grams per day of soluble fiber. So eating again your fruits, vegetables, beans, barley, oatmeal, oat bran, and psyllium. This diet includes more of a calorie restriction, or just taking in enough calories to maintain a healthy weight. So probably will promote some weight loss, which is going to improve your cholesterol. And then focusing on your active exercise most days of the week. So that's the TLC diet. There's also something called the DASH diet, and maybe you've heard of this one before. So this DASH diet is recommended specifically for people with hypertension or high blood pressure. And it is based on an eating plan rich in fruits and vegetables, low fat, non-fat dairy, whole grains, high in fiber, low to moderate fat, rich in potassium, calcium, and magnesium. And it is based on research studies. So the DASH acronym stands for Dietary Approaches to Stop Hypertension, and it has been shown to lower blood pressure, reduce cholesterol, and improve insulin sensitivity. Here is a chart for you that kind of gets more into what the foods are on a DASH diet. So I'm going to focus on this column here on the right for a 2,000 calorie diet. Most of us are probably under that, but this would be kind of a good starting point. So it starts with grains and grain products and says 7 to 8 servings of these per day. So the thing to remember is, what is considered a serving of grains? Because I think when I say, 7 to 8 servings per day, that people think that sounds like a lot because we're used to hearing about low carb diets. But what is a serving of grains, which tends to be, like a 1/3 cup to a 1/2 cup of pasta or rice, or often, just 1 slice of bread, those kinds of things. So learning what a serving is of grains, 3 to 5 servings of fruits per day, 4 to 5 servings of vegetables, and then focusing on your low fat or non-fat dairy foods. Lean meats, fish or poultry, 2 servings or less per day, and then really getting in more of those nuts, seeds, and legumes, so 4 to 5 per week, and then being mindful of the added fats and sweets. So again, the key here is going to be like that vegetable column is, 4 to 5 servings per day, which is quite a bit of veggies. Okay, so then finishing up here with the Mediterranean diet. So the Mediterranean diet is also known as the anti-inflammatory diet, and this is probably the one that I promote the most for cancer prevention. It is recommended by the dietary guidelines for Americans to promote health and prevent chronic disease. So again, lots of vegetables. If you eat meat, have smaller amounts. Eat some dairy products. It doesn't really focus on like that it necessarily has to be your low-fat dairy products, but eating plain yogurts and smaller amounts of cheeses. Seafood twice a week. Having a vegetarian meal 1 night a week, using your good fats, olive oil, eating nuts, peanuts, sunflower seeds, olives, and avocados, switching to whole grains. And this definitely focuses more on whole grains than the other diets. And then eating things like your bulgur and barley, black or red rice, and then fewer products. I might have a typo there, but choosing things that are made with whole grain flours like whole wheat breads and whole wheat pastas, but really getting in more of the whole food grains like the bulgur and quinoa and those kinds of things. And then for dessert, encouraging your fresh fruit intake for dessert is what is recommended on the Mediterranean diet. Okay, so then 2 more of these little charts to show you. So this again is from the American Institute for Cancer Research. So the column I want to show you here is this one with all the light green boxes. Light green, if we look at the key, is talking about that there's limited evidence, but there's suggested decreased risk of several different cancer types. And so this green column here is your non-starchy vegetables. And so there's limited evidence, but suggested decreased risk of mouth cancer, esophageal cancer, lung cancer, and both pre and postmenopausal breast cancer. And then some of these other light green boxes over here on the right, the 11, 13, 15, and 17, those are all underneath of different antioxidants, so carotenoids, vitamin C, isoflavones. So eating more of those in your fruits and vegetables reduce your risk of lung cancer, stomach cancer. The carotenoids decrease risk of pre and postmenopausal breast cancer. So just kind of making the argument here for increased fruit and vegetable intake to get all those good nutrients. Okay, and then this slide is about meat and cancer risk. And so I just want to direct you over to the right where all these yellow boxes are. And really the point I want to make here is that, okay, so the yellow boxes is limited evidence, but there's suggested increased risk of different types of cancer. And not wanting to make the point that we all need to follow a vegetarian diet, and these studies are done on, red meat and processed meat consumption on a daily basis. So that consuming those on a daily basis increases cancer risk. So it comes back to the variety piece. So having, red meat one night, and then getting in your seafood, and having your one night a week of a vegetarian meal, and eating more beans, and then having, chicken and some other type of seafood. So having a variety instead of red meat and processed meat on a consistent basis. Okay, so I only have a few more slides left, so make sure that you're getting your questions in that you would like to ask. But just finishing up with, really the main thing that all these diets had in common was your fruits and vegetables, whole grains, lean proteins, eating more nuts, lentils, legumes, beans, low-fat dairy, and being mindful of added fats and sugars. So really any of those diets that I talked about, their basis is all the same. So they would all kind of really be a healthful diet to follow. This slide comes from that continuous update project that I was talking about. And so this is just their cancer prevention recommendations. And I wanted to show this because it just kind of pulls together kind of the whole talk today in regards to all the things recommended for cancer prevention. And we could probably just put the American Heart Association symbol on this slide as well. But be a healthy weight, be active, eating a diet rich in whole grains, vegetables, fruits, and beans, limiting consumption of fast foods, limit consumption of red and processed meat, limiting your consumption of sugar sweetened beverages, and limiting alcohol. So kind of all the same recommendations, just kind of wrapped up into a nice pretty slide. If you're looking for more nutrition resources, I just wanted to give you these different associations and groups. If you're want just some good information. I know there's a lot out there online, and so it gets kind of confusing and scary as to who's providing up-to-date and accurate and research-based information. So I just wanted to give you all of these different associations and groups if you're wanting more nutrition information regarding heart disease, diabetes, or cancer. And then finally, I promised you the website. It's down here on the right. This is the website for the Continuous Update Project. It's dietandcancerreport.org. Okay, so that is all the information I have. So I am ready for some questions.
All right. So it looks like we did get one question submitted ahead of time. That question was asking if you could review the best diet to decrease cholesterol levels. I believe you did touch on that briefly, but is there anything else you would like to add?
Sure. Yeah, I don't know that there's one particular diet that is the best. Any of those diets that I talked about are, going to be very healthy and give you, what we recommend to reduce cholesterol, which is, fruits and vegetables, which will give you antioxidants, really focusing on your fiber intake, limiting your total fat and saturated fat intake. That's going to reduce your cholesterol. Getting in the omega-3s, so the salmon, the walnuts, the avocados. Yeah, those are in all of those different diets that I talked about really kind of focus on the same thing. So they would all give you a good benefit for reducing cholesterol.
All right, thank you. And then the next question we got in the chat box is regarding the keto diet. They are wondering, is the keto diet good for cancer patients?
Okay. All right. Good. I'm glad. I always like to talk about the keto diet. So the keto diet, so I'll just give you a basic definition of what it is 70% of your calories come from fat, 15% of your calories come from protein, and then the rest come from carbohydrates. And so I like to go at it from like a pros and cons type of perspective. So if I first start following a keto diet, basically I'm eating meats and vegetables, non-starchy vegetables and fats, but most of my calories need to come from fat. Where you can get some benefit in the beginning is that you do lose weight on a ketogenic diet and you do lose it quickly. And so you are going to kind of have that immediate benefit of with the weight loss, like improvement in blood sugars, improvement of insulin resistance. You're going to have lower cholesterol levels in the beginning because of this drastic weight loss that will occur when you start the ketogenic diet. And then also, if you were somebody who was eating a lot of high carbohydrate foods and high sugar foods, if you're not eating those anymore on this diet, then you're going to have that kind of benefit there of reducing your sugar intake. Where it gets concerning is, I showed you those charts of all the, recommended intake of fruits and vegetables to decrease cancer risk, and also that chart of the consuming red meats and processed meats on a daily basis increases cancer risk. And so that's where I get concerned about the ketogenic diet. Also, we know that eating a very high fat diet increases risk of several types of cancer. So I do get concerned from that perspective in regards to that the ketogenic diet is so high in fat. You don't really get any fiber on that diet, and you're missing out on the benefits of whole grains, which also have protective properties against different types of cancer. Making sure that you have adequate calcium in your diet is protective against different types of cancer, so you're missing that from a ketogenic diet because you're not consuming dairy products. So, and I think there's two different ways to kind of do a ketogenic diet. Like there's, some people who are really excited because all of a sudden they can eat as much butter and bacon and cheese as they want. But I think that following it that way is definitely going to increase your risk more than if you were to eat, salmon and vegetables and, those types of foods. But, is that sustainable? How many healthy meals can you come up with that? And then also, like I said, just the long-term concerns of what happens when you don't get enough fiber, when you're not getting in enough fruits and vegetables, and eating a high fat diet like that on a daily basis. What are the long-term effects?
All right, that was a great answer. Let me check the chat box here. And it doesn't look like we've got any questions yet. Let's give everyone another minute or so to submit any final questions, and then we'll proceed with the closure of today's webinar.
Okay. Well, while we're waiting, we had one other question that was emailed ahead of time. And so it's not necessarily related to this talk, but I'll go ahead and try to answer it while we're waiting for a few more questions, hopefully.
Yeah,
and this was in regards to supplements and taking antioxidants during treatment, and whether it's okay to do that, or is it okay to eat foods that are high in antioxidants. And so as a general rule, during treatment, whether it be chemo or radiation, we recommend that people get their nutrition from food. We don't recommend any type of high dosing of antioxidants or high dosing of vitamins and minerals. The thought behind that is that if you're taking high doses of these things, is it offering protection to the cancer cells? But consuming them through food is completely safe. There's so much we don't know about, how our food works together. If we're eating a variety of different fruits and vegetables and whole grains, how do those foods all work together to make our, immune system really healthy? We don't know all that. And so that's, I think, why we can't make any good recommendations at this point, is like, this is the supplement to take during treatment, or this is the antioxidant to take during treatment. Because there's so much we don't know about, like food synergy and how things work together. So overall, the answer is that it's completely safe to eat a variety of fruits and vegetables and whole grains that contain antioxidants in food form during treatment. And it's really beneficial to keep your body healthy while you're going through treatment.
Thanks for touching on that, Athena. That's really interesting. And actually, I just learned something too. So thank you. It looks like we don't have any other questions. So let's proceed with the end of the presentation. We wanted to let everyone know about our next webinar that we're going to be hosting in December. This will be on the topic of prostate cancer research 101. We'll send out a link for everyone to get registered, but be on the lookout for that email. And then we will be sending the recording out for everyone to watch at their leisure. If anyone has any questions that come up, please feel free to email us at cancerresourcecenter@samhealth.org, and we can filter those questions over to Athena for her to answer. And we also have a survey that we'll be sending out. If everyone could take the time, we really appreciate that. Those surveys really do help us provide valuable feedback for our future events. All right, so that's the end. Once again, I want to give a huge shout out to Athena. Thank you so much. And thank you to everyone that was able to attend today. We really hope to see you at our upcoming webinar in December, and have a great rest of your afternoon.